My name is Carter with Carter Physiotherapy, and this is going to be a very short video showing just 3 very simple core exercises that I give to a lot of my patients when they've had either chronic back pain or acute back pain. It's very important if you've hurt your back or you've had a long-term issue in your back that you try to move and exercise as normally as possible, as long as those movements and those exercises don't cause an increase in your pain. So these are very simple exercises to activate some of the core muscles that tend to get weak after dealing with a bit of back injury or back pain over time. So first thing we're going to do is activate a muscle called the transverse abdominis by drawing the belly button in towards the spine. It's like you're trying to place the belly button on your spine. If you're doing it right, you feel just inside the hip bones here, you'll feel the muscle push a little bit into your finger. If you don't feel that, don't worry so much about it. More so, just think about drawing the belly button into the spine and firming up your abs just slightly. With that in place, you're going to lift one foot just to where it's unweighted and keep your hips as level as possible. So the idea here is that you are simply drawing the belly button to spine, activating the core muscles, and then balancing on one leg for about 5 seconds at a time. And as you lift the other leg, you're going to be going back and forth from side to side. You're going to make sure that you're keeping your hips level, that you're not lifting a leg and dropping the hip out to the side or dropping the unweighted side down. You want to activate the core, lift the foot, and keep the hips nice and level. You're going to go back and forth 5 seconds on each side for a minute or 2 at a time, a few times a day. Next exercise is a very simple bridge exercise. A lot of people start out bridges and simply push straight up and go into an arch in their low back. That's not what we want to do. First thing first, again, activate the core, belly button towards the spine. Then you're going to tilt the hips a little bit, trying to flatten out the low back. And then keeping that core activated and keeping the hips tilted back, you're going to lift up until your torso and legs are in one line. You don't need to go past that. Again, we're trying to avoid arching in the low back. So again, belly button to spine, tilt the hips, flatten the low back, then lift up, keeping the low back nice and flat. Coming back, you would repeat that until you get a little bit of a fatigue. In terms of numbers, you want to reach out to your healthcare practitioner to confirm these things, but this is just something to get started in terms of activating your core muscles and not getting in a habit of moving too carefully and ending up with a lot more weakness than you need to be dealing with. The last of these 3 exercises, you're going to get on all fours. Now, a lot of people teach this bird dog exercise where you come way out with the arms and hands, and I don't really like that, because if you're getting way back with the leg like this, some of the larger muscles in the back get more active than I prefer. I like the little tiny core muscles all along the spine to be the ones that are doing most of the work. So you want to have a nice flat back. Again, belly button to spine, activate the core, and then you're just going to slide one leg back until it's just unweighted. That's all you need to do, and then come back in. Slide the other leg out till it's just unweighted. Come back in. Notice that as I do this, I'm not dropping my hips or moving my back that much. I'm staying pretty still, and my belly button is staying way back on the spine, activating my core. You can also add raising the opposite hand once you kind of get to a point where you can do that without much problems and without losing your balance. So again, these were 3 quick exercises to activate the core. Try to avoid as much weakness from developing while you're having back pain, which tends to be associated with longer-term chronic issues. If you have any questions, you can always reach out to us at carterpt.com. Thanks so much for tuning in.